Hi, I'm Mary Jo. I've been a nurse for 50 years, and I have lost over 100 pounds as a postmenopausal woman and reversed all chronic disease in my life. I'm here to chat a little bit about GBOM's acronym as related to the last letter S, seeds and nuts. Seeds and nuts have a beautiful portfolio of micronutrients and what I call healthy fats. I don't think any diet should be devoid or limited on fat, carbohydrate, or protein, though finding the right proportions can sometimes be confusing depending upon the literature that you may see or the Facebook pronouncements that may exist. Nuts, seeds and nuts are a very healthy fat. Your seeds contain a lot of omega-3s, and walnuts contain omega-3s. Uh, the other tree nuts contain a very healthy portfolio of omega-6s. Now, if you were to take a tablespoon of extra virgin olive oil, and even though health outcomes are better than if you were using a tablespoon of butter, you will find that all the oils, including olive oil, it does not require really any digestion. It's free-floating fatty acids. They absorb, they just smack themselves on your thighs or your hips. They can also increase your appetite. There's 14% saturated fat in extra virgin olive oil. Now, how is this different from seeds and nuts? Well, nuts and seeds contain a significant fiber and food matrix. That means they are digested over a significant period of time, and the fatty acids, which are slowly released through digestion and absorption, and are shunted towards energy purposes. Your body doesn't get a deluge of these fatty acids. It just gets it very slow. Nuts and seeds contain a very minuscule amount of saturated fat, and I have been trying to figure out if saturated fat is good or bad in the diet. One of the things that's very interesting is because as this absorption process is so slow, the saturated fat in nuts and seeds, once again, is shunted to energy production rather than to fat deposition. I think that's amazing and wonderful. Several very interesting studies have identified that nuts and seeds diminish all-cause mortality. You can look at the Adventist health studies 1 and 2, the physicians' health study, the nurses' health study, the Iowa nurses' health study, and the CARE study to find the remarkable impact of nuts and seeds. More recently, in 2013, the New England Journal of Medicine provided an article that depicted how all-cause mortality is affected by the inclusion of nuts and seeds in the diet. And you know, many of these studies were not related to nuts and seeds on a vegan diet, but it could be just nuts and seeds on the standard American diet. Irregardless of how the study was created, the inclusion of nuts and seeds where they did not exist before diminished all-cause mortality. In the New England study, it was 22%. That is considered a highly significant number. Now, if you put this together with the health promoting effects of the rest of your GBOMs, I think you can see that percentage would increase remarkably. Now, nuts and seeds are fabulous. They provide a healthy fat, and what's really interesting is that when you're eating, there are a lot of nutrients that are fat soluble. I mean, you've heard of fat soluble vitamins, right? Well, you can't absorb them if you ingest them per mouth without a fat vehicle that will attach to them and take them across into the bloodstream. So, having a certain amount of fat with especially your vegetables is going to increase the bioavailability of nutrients by 50 to 70%. And by doing this, it also dramatically increases the antioxidant capacity of your tissues, which may partially explain why nuts and seeds are so protective and diminish all-cause mortality. Another interesting fact about nuts and seeds is that they can assist weight loss efforts. Now, you can also overeat them very easily, and this would not seem to be the case for you. But in most situations where nuts and seeds are included in an appropriate caloric content for that particular client, it creates satiety because it takes so long to digest them. It diminishes appetite, so people are less interested in eating. You may wonder, is that possible? And yes, it is, because now that I've started eating per G-bombs, I find it wonderfully free that I get full and do not want to eat for a period of time. Isn't that to me is a miracle. So nuts and seeds can be helpful on people who are trying to lose weight. Now, there has also been vegans who have been on a very, very low-fat diet, less than 10%, which can cause some problems, some health problems actually. And some of these people ran into a problem with weight loss when they were still overweight. But including a small amount of nuts and seeds allowed the weight loss to continue. Another wonderful thing about nuts and seeds is that when you find the right way, the healthiest way to nurture the human body with delicious, delectable foods, you find that you lose weight rather rapidly. And rapid weight loss is associated with gallbladder problems. But the inclusion of just a small amount of nuts and seeds in the diet prevents this occurrence. That is wonderful. So you can lose weight and be happy and not worry, keep your gallbladder functioning as well. Now, other things I think about whenever I think about nuts and seeds as a diet are two other ideas. It's highly cardioprotective and also neuroprotective. Nuts and seeds in the diet diminish arrhythmias of the heart. They stabilize heart rhythm, prevent atrial fibrillation. They diminish, as I already said, cardiac events by 60%. They decrease cholesterol. They decrease LDL. And what's more important, when LDL is oxidized, it becomes a very low-dense molecule. That molecule is the one that creates atherosclerotic heart disease and causes the most problem. It diminishes the capability of LDL to be oxidized and inhibits your very low dense LDL particles. It increases HDL, considered the good cholesterol. Now, LDL is called the bad cholesterol because it's like a carrier molecule that escorts fat into blood vessels, and it can be used to spackle any broken areas of the blood vessel, but unfortunately can sometimes eventually cause havoc. HDL is a carrier molecule that escorts fat out of the blood vessel and to the liver to be metabolized and sent elsewhere. Nuts and seeds contain sterols and stanols, and sterols and stanols kind of go to cholesterol and bring it into the bowel, and it goes out the back door. So it's highly cardiac protective. It also decreases triglycerides. Now, one thing that nuts and seeds have been proven over and over to accomplish that I don't completely understand the mechanism is they help modulate blood sugar. So they're good for diabetics. They can help provide a much more normal and stable blood sugar. Very interesting. Flax seeds, a study was done specifically on flax seeds and found that flax seeds in and of themselves had a powerful blood pressure lowering effect. Flax seeds, chia seeds, hemp seeds all contain omega-3s, and flax and chia, I believe, both contain significant amount of lignans, which are those phytoestrogens that inhibit the ability of endogenous estrogen from stimulating breast tissue or prostate tissue, diminishing opportunity for breast or prostate cancer. which is wonderful. Another thing that nuts and seeds do related to cardiac events is they increase vascular elasticity, which is extremely helpful and blood pressure normalizing. So nuts and seeds, highly cardioprotective. Now, one thing that was interesting to me, one day a gentleman is talking to me and we're getting ready to go into an exercise class, and he said to me, you know, the human brain began to grow more after people included meat in their diets. Well, there is some truth to that statement, but if you look into it, you will find out it wasn't so much the meat protein as it was increasing fat in the diet. Because when fat was increased in the diet, the brain grew and took off. And how is that possible? Well, look at the brain under a microscope. It's fat. Your brains are all fat. Isn't that just wild? So omega-3s are instrumental in protecting the brain, prevent aging response, encourage neurogenesis, in creation of new neurological cells, neuroplasticity, allows you to continue to learn and remember throughout life, prevents the brain from aging. It also has an anti-seizure effect. Oftentimes people with problems associated with like ADHD are found to have significant omega-3 deficiencies in their diet. That may not be the only concern, but it certainly does seem to help diminish the opportunity for that to occur. It was also found that a diminished amount of omega-3s in the diet seems to be linked significantly with Parkinson's disease and essential tremor. So you want to make sure that you get your nuts and seeds and get your adequate omega-3s. And it's not a bad idea to get a blood test to make sure that your omega-3/6 index is 5 or higher. It's also interesting to note that there's a certain amount of cancer protection from nuts and seeds, and perhaps the best way to explain that is the impact of lignans on hormonal cancers, diminishing the opportunity for proliferation of abnormal cells. There's a few miscellaneous pieces of information. Actually, if you look up each and every nut and seed, you're going to find a beautiful portfolio of different phytonutrients associated with them. Things that I remember off the top of my head are that pumpkin seeds have a high concentration of zinc. Now, for people my age, that can be important because limited amount of zinc can encourage the immune system to become a little dysfunctional and increase opportunity for pneumonia to occur. There's zinc in many other vegetables as well, but the phytates in vegetables sometimes diminish its ability to be absorbed. So it's one of those things that people need to be concerned about. Is adequate in their diet, or do they need a supplement for it? So I always like throwing some pumpkin seeds on my midday salad. Sesame seeds are extremely high in calcium. I know they're little itty bitty tiny things, but extremely high in calcium. Nuts and seeds taken together, a very high protein food, extremely good for the athlete. Well, there you have it. That's my attempt to provide or encapsulate information, and there's way more than what I had to say about nuts and seeds. They prevent all-cause mortality. They are extremely cardioprotective. They are neurologically protective. They help and aid and assist weight loss. They prevent gallbladder disease if you happen to lose a significant amount of weight in a confined period of time. They are anti-cancer, and they are high protein. So get yourself a bowl of nuts and seeds and have fun. Well, maybe not. I like to use nuts and seeds in recipes that produce salad dressing, sauces for vegetables, and crusts for desserts. Okay, that's it for today. I hope you found this somewhat entertaining, but remember, this is all about you. So please take best care of you, because you are so important to all of us. And this today is good night. Goodbye now from Nurse Mary Jo, Have a wonderful day.